Hello, this is my channel, Amir Hasaballah from Egypt, and this is my lecture today about primary sclerosing cholangitis and primary biliary cholangitis, previously named primary biliary cirrhosis, primary sclerosing cholangitis. Concentrate with me. This is the liver. We have the intrahepatic bile ducts, which unite together to form two main hepatic ducts, the right hepatic duct and the left hepatic duct, which unite to form the common hepatic duct here. Common hepatic duct unites with the cystic duct of the gallbladder to form the common bile duct. Common bile duct unites with the pancreatic duct, and here in the second part of the duodenum it powers its bile. This is the biliary system. The biliary system is composed of intrahepatic bile ducts, small ones, which unite to form two main hepatic ducts, which unite to form the common hepatic duct, which unites with the cystic duct of the gallbladder to form the common bile duct. Common bile duct passes behind the first part of the duodenum and unites with the pancreatic duct behind or within the head of the pancreas and opens in the second part of the duodenum. And what's going on now in this disease? Primary sclerosing cholangitis. There is increase in the resistance to the bile flow, increased resistance to bile flow, and so the bile builds up in the liver, leading to liver injury, chronic hepatitis, which ends by fibrosis and liver cirrhosis. Increased resistance to bile flow occurs because of inflammation of the intra and extrahepatic ducts. Look here, the intrahepatic bile ducts and the extrahepatic, which is a common bile ducts, there is inflammation in the wall. Inflammation and scarring of the intra and the extrahepatic bile ducts, leading to hardening of the wall of the bile ducts. This is called the sclerosis. This hardening and fibrosis and scarring due to inflammation is called the sclerosis, and hence the name primary sclerosing cholangitis. Cholangitis refers to the bile ducts. This leads to strictures and narrowing of the bile ducts, and here is the problem: increased resistance to bile flow, with bile building up back in the liver, leading to chronic inflammation of the liver and liver cirrhosis. Again, primary sclerosing cholangitis, it's a rare disease of the biliary system. The biliary system here consists of intrahepatic bile canaliculi, which unites together to form two hepatic ducts, the right hepatic duct from the right lobe, the left hepatic duct from the left lobe, which unites to form the common bile duct, which unites with the cystic duct to form the common bile duct. Common bile duct unites with the pancreatic duct to power its contents into the second part of the duodenum in the ampulla of water. The ampulla of water. And this ampulla of water is surrounded by a sphincter called the sphincter of Oddi. The sphincter of Oddi. What occurs in primary sclerosing cholangitis is that there is increased in the resistance to bile flow, which leads to bile accumulation in the liver and liver cirrhosis. And this occurs because of inflammation and scarring in the wall of the common bile duct and intrahepatic biliary ducts, leading to hardening of the bile duct and sclerosis, strictures, narrowing of the bile ducts. The strictures and narrowing in the bile ducts occurs in some parts of the common bile duct and skips other parts. Here is the view again. The intra and extrahepatic bile ducts become strictured with inflammation interrupted. This leads to this appearance which appears in front of you, which is a beading appearance, and this is very characteristic and very important question in the United States license examinations and the MRCP. There is beading of the common bile duct. The common bile duct becomes like a beading appearance. This disease is a rare disease with prevalence 6 per 100,000 cases. 6 cases only per 100,000 population. It's 6 cases in 100,000 population, and it is a disease of males and their middle age, 30, 40 to 40 years. Let's discuss what is the pathogenesis of this disease. This disease is highly linked to a disease, common one. It's called the inflammatory bowel disease. And the inflammatory bowel disease consists of two main diseases: the ulcerative colitis, which affects mainly the colon, and the Crohn's disease, which affects any part of the gastrointestinal tract. The pathogenesis of this primary sclerosing cholangitis is similar to that of ulcerative colitis, with genetic predisposition, with association with these genetic mutations, HLA-B2, HLA-DR3. There is increased association of primary sclerosing cholangitis in these alleles, HLA-B2, HLA-DR3, and there is abnormality in the microbiota, which is called also dysbiosis. Dysbiosis is abnormal bacteria of the gastrointestinal tract which passes into the bile ducts and activates the immune system. This finally leads to epithelial injury of the epithelium of the bile duct. This epithelial injury leads to this inflammation because the wall of the bile duct become exposed to the highly injurious bile salts within it. This is the primary sclerosing cholangitis. What are the clinical manifestations of primary sclerosing cholangitis? Number one, it may be asymptomatic and accidentally discovered. It may be present by non-specific symptoms like fatigue, nausea, vomiting, upper abdominal pain, and may present only by itching and pruritus. It's one of the cholestatic liver diseases, which present by pruritus due to escape of the bile salts into the circulation and causes itching. It may present by jaundice, which is mostly obstructive jaundice, and vitamin deficiencies, especially fat-soluble vitamins. We know that this bile is very important for the digestion of fat, which contains the fat-soluble vitamins, which is A, D, E, and K vitamins. So the patient may present by the deficiency manifestations of these diseases, like vitamin K deficiency, which presents by bleeding tendency and ecchymosis, vitamin D deficiency, which presents by osteoporosis and bony pains, vitamin A deficiency, which presents by night blindness, etc. And let's go to the investigations and the diagnosis. There is increase in the alkaline phosphatase, and the gamma GT, which means that this patient has a cholestatic pattern of hepatitis. There is also positive B ANCA. ANCA is anti-neutrophil cytoplasmic antibody, B ANCA, which is present in cases of vasculitis. We have a term called the ANCA-associated vasculitis. And the diagnosis is confirmed by making what's called the MRCP, or the magnetic resonance cholangiopancreatography, or ERCP, It is the endoscope which passes here in the second part of the duodenum, and we inject a contrast medium to delineate this pancreatic duct and common bile duct. The appearance will be beading. There is beading appearance in the common bile duct, and it's the diagnostic. It's more important than P-ANCA. It's more important than anti-smooth muscle antibody, which is positive in some cases, anti-nuclear antibody, which is positive in some cases, and we discussed these antibodies in the lecture of autoimmune hepatitis. And if there is association between autoimmune hepatitis, which means that the liver enzymes are very high, up to 10 times the upper limit of normal, and the association with this beading appearance and cholestatic pattern, that's called overlap syndrome. The overlap syndrome. Overlap syndrome is a syndrome of association between primary sclerosing cholangitis and autoimmune hepatitis. Let's go now to primary biliary cholangitis. This previously was called the primary biliary cirrhosis. Primary biliary cholangitis. It's due to destruction of mainly the intrahepatic bile ducts, while in primary sclerosing cholangitis it was the intra and extrahepatic bile ducts. Intrahepatic bile ducts, which means the small ones. In primary sclerosing cholangitis, the prevalence was mainly in males, but here it's a disease of female, so it's mainly an autoimmune disease. Female to male ratio is 9:1. There is a destruction of the intrahepatic small bile canaliculi, small intrahepatic bile canaliculi, and pathogenesis is reduced immune tolerance. This reduced immune tolerance leads to accumulation of lymphocytes around the bile canaliculi and the plasma cells, which secretes a very characteristic, which is positive in 90% of cases, of anti-mitochondrial antibody. Anti-mitochondrial antibody is very specific and the characteristic of primary sclerosing cholangitis. Biliary epithelial anti-mitochondrial antibody is very specific for primary biliary cholangitis, present in up to 90% of cases. And there is destruction of the intrahepatic small bile ducts or bile canaliculi. There is a female predominance, and also there is reduced immune tolerance, which leads to accumulation of lymphocytes and plasma cells around and destroy the small bile canaliculi. What about the clinical manifestations? It may be asymptomatic, just like primary sclerosing cholangitis. Non-specific manifestations like fatigue, weight loss, nausea and vomiting, upper abdominal pain, persistent itching, and this is the most common presentation. When you find a female in their 20s presenting by itching, persistent itching, seeking for dermatologic consultations without benefits, think about primary biliary cholangitis. This is the most common presentation. What about the liver biopsy? There is small bile ducts or the bile canaliculus destroyed with infiltration by inflammatory cells, mainly the lymphocytes and the plasma cells. It's very characteristic. And the anti-mitochondrial antibody is positive in 90% of cases. When you have these, and so the liver biopsy will show small bile duct destruction with infiltration with inflammatory cells, and the serology will show anti-mitochondrial antibody positive in up to 90% of cases, and the female is about 25, 27 or in the 30s of her age, presenting by itching. This is a classic picture of primary biliary cholangitis. And so what are the differences between primary biliary cirrhosis and primary biliary cholangitis and primary sclerosing cholangitis? Primary sclerosing cholangitis is a rare disease. Primary biliary cholangitis is more common disease. Primary sclerosing cholangitis is mainly a disease of male, and the primary biliary cholangitis is a disease mainly of female. with the female to male ratio 9:1. Primary biliary primary sclerosing cholangitis affects the intra and the extrahepatic, while primary biliary cholangitis affects mainly the intrahepatic, and this is in the pathology. In the pathophysiology, the primary biliary cholangitis is mainly autoimmune disease with destruction of the small bile ducts, while there is a pathogenesis of that of ulcerative colitis, which is microbiota or dysbiosis abnormalities and passage of the bacteria to the bile duct with activation of the immune cells, leading to epithelial injury and the formation of the scab lesions. You know, this scab lesion resembles that of Crohn's disease and gives a characteristic bleeding appearance. And other differences is that the serology in here in primary biliary cholangitis is mainly anti-mitochondrial antibody, and this is a question in the United States medical license examinations, and the question in the MRCP. Anti-mitochondrial antibody is positive in up to 90% of cases, while the P-ANCA is positive in cases of primary sclerosing cholangitis, and there is a bleeding appearance with MRCP or ERCP. The clinical manifestations are mimics it's other, maybe asymptomatic, non-specific manifestations. Itching is very characteristic in primary biliary cholangitis. What about the treatment of primary biliary cholangitis and primary sclerosing cholangitis? We give also deoxycholic acid in large doses, mainly 25 mg per kg per day, and obeticholic acid. This is more recent one, obeticholic acid, and we may give cholestyramine to reduce the itching. The cholestyramine inhibits the reabsorption of bile at the enterohepatic circulation, and so it decreases the itching. And is this a curative treatment? Of course no. What is the treatment of liver cirrhosis in the stage 1? Liver transplantation. Is there any medical treatment effective to prevent the progression of primary sclerosing cholangitis or primary biliary cholangitis? No. The answer: in the United States, is there treatment? No. In the United Kingdom? No. In Japan, in Germany, all over the world, nobody until now discovered treatment of these two diseases, and so there is an inevitable mortality which occurs within 15 to 20 years in these two diseases. So these two diseases are very dangerous, very important diseases. Primary sclerosing cholangitis. What are the associations between two diseases? Other autoimmune diseases. There is a strong association between primary sclerosing cholangitis and ulcerative colitis in up to 80%. You can imagine 80% of cases. And primary biliary cholangitis or primary biliary cirrhosis, there is a strong association between it and celiac disease, Sjogren syndrome, Hashimoto thyroiditis. What is Hashimoto thyroiditis? Describe and comment on my video and follow my channel, subscribe and like. I am Amir from Egypt and this is my channel.